Well, we started our Dr. Plus in 2020 when we first got listed and we launched our Dr. Plus into the community. There's always been my vision to bring pain care into the masses. Pain care is not just meant for specialist care. A lot of people come to see me for specialist treatment, but we want to bring pain care to the masses, to bring it down to the ground. And we have successfully done that through our Dr. Plus model, the Dr. Plus Medical and Paincare Clinics. So through this initiative, we could reach our patients in the community, whereby we can cover their pains using bedside procedures and treatments, achieving at least 70% pain relief, and achieving as well the patient satisfaction of 80 to 90%. These are for conditions that are what we call difficult to treat. We talk about, degenerative conditions, weird and wonderful pain that is very difficult to treat, and we are able to do that. Pain itself affects a whole variety of different age group. Of course, what is quite unique to us is that we feel very much for the patients that are aging, because there's a lot of degenerative pain conditions, whether is it arthritis of the knee, whether is it spine stenosis, bone spur causing nerve compression, etc., etc. Patients can grow old. Patients can degenerate. You don't have to live with pain. So we can get rid of the pain generator, we can stop the pain, and be able to free the patients from their pain. So through Dr. Plus Medical and Paincare Clinics, we are able to deliver very good pain relief to the patient through what we call minimally invasive injections. So through these injections, we are able to alleviate the patient's pain. They don't have to take painkillers on a long-term basis. They don't have to suffer their pain in silence. And through our bedside injections, our doctors, our pain care doctors, are able to deliver very effective alternative to open surgery and controlling their pain. I believe that we are the first, maybe I think the only pain care group that actually focus on providing a very specialized pain care treatment at the primary care level. Through our network of doctors, we want to be able to permeate into the every constituency. We would like to make pain care a new focus or initiative that maybe the government can look at, because we believe that patients don't have to suffer in pain. And through our algorithm of pain treatments, through our interventional pain procedures, injections, etc., we are able to deliver this kind of care to the ground and to meet the needs. Currently now, there isn't any of such pain care treatment. Most GPs will either give painkillers for pain conditions, or they send to the specialist, or they refer to the physios or whatever. This is a bit like growing a new discipline. Just like how aesthetic GPs started 10 years ago. You never heard of GPs with aesthetic, right? But you've heard of it now. So now we are starting this pain care GPs now. So I hope to be able to see this in the next 5 years, that you will see this commonplace, whereby pain care GPs are the first line of treating patients with pain in the community. We control very seriously the standard of care, our processes, our IPs, and the way we actually treat the patient. We keep an eye on the outcomes. We want to achieve that outcome consistently. We don't want to ever get into a situation whereby patients gets unhappy and then they feel their pain is not well treated, etc., etc. So as we expand on the Dr. Plus growing in the community and all that, we see that there will be opportunities whereby we can even franchise. That may not be just our group itself, that we can actually train other doctors that are not within our group. We have our own Pain Care Academy, whereby we go through a very strict process of our own training and our own audits. So in that way, we ensure a very high standard of care. I mean, that's for our local expansion. We intend to just grow every few months a clinic to be able to make sure that there will be a pain care clinic in every single constituency of Singapore. For overseas, we are setting our sights in Southeast Asia, whether it's in China, Vietnam, Thailand, Malaysia. So the need is there. There are many patients out there in all these countries. So far, they don't have something like that. They don't have a pain care GP out there. As I said, you're either stuck with painkillers or you undergo the knife and have surgery, or you're stuck with the pain and saying that, oh, you're too bad, you're suffering, you're aging, and you've got no choice about it. So we are looking at growing overseas to be able to bring pain care to the surrounding region. And we want to make Singapore pain care the beacon, the center of whole of Southeast Asia.